After being nailed at a public event in Washington, D.C. by EIR historian Tony Chaikin for his long-term push for euthanasia in the United States, President Obama's special advisor for health policy, Ezekiel Emanuel, has been recently screaming, "I'm really not for euthanasia." He's lying. Freak Ezekiel is a liar. January of this year, 2009, Emanuel co-authored along with some other Nazi doctors an article in the Lancet Journal entitled Principles for Allocation of Scarce Medical Interventions. In it, they call for making yet another advance in the practice of withholding care from patients. But before we get into that article, let's take a trip back through memory lane and revisit Tony Chaikin's intervention and Ezekiel's big lie.
So we'll do the same format. It'll be 3 minutes and then time for questions. We'll start with Mr. Chaikin.
Anton Chaikin. I'm a historian and the history editor for Executive Intelligence Review. President Obama has put in place a reform apparatus reviving the euthanasia of Hitler Germany in 1939 that began the genocide there. The apparatus here is to deny medical care to elderly, chronically ill, and poor people, and thus save, as the president says, $2 to $3 trillion by taking lives considered not worthy to be lived, as the Nazi doctors said. Dr. Ezekiel Emanuel and other avowed cost cutters on this panel also lead a propaganda movement for euthanasia headquartered at the Hastings Center, of which Dr. Emanuel is a fellow. They shape public opinion and the medical profession to accept a death culture such as the Washington state law passed in November to let physicians help kill patients whose medical care is now rapidly being withdrawn in the universal health disaster. Dr. Emanuel's movement for bioethics and euthanasia and this council's purpose directly continue the eugenics movement that organized Hitler's killing of patients and then other costly and supposedly unworthy people. Dr. Emanuel wrote last October 12th that a crisis, war, and financial collapse would get the frightened public to accept the program. Hitler told Dr. Brandt in 1935 that the euthanasia program would have to wait until the war began to get the public to go along. Dr. Emanuel wrote last year that the Hippocratic Oath should be junked. Doctors should no longer just serve the needs of the patient. Hoche and Binding, the German eugenicists, exactly said the same thing to start the killing. You on the council are drawing up the procedures list to be used to deny care, which will kill millions if it goes ahead in the present world crash. You think, perhaps, the backing of powerful men, financiers, will shield you from accountability, but you are now in the spotlight. Disband this council and reverse the whole course of this Nazi revival now.
Thank you. A quick break. I'm going to ask for questions and comments. Ms. Zuckerman, if you can come up, and I'm opening it up to the panel. Yes, we're still going to, Ms. Williams, you're still going to get to talk. I'm going to ask Ms. Zuckerman to come up and join you. We're going to take a quick stop in the panel to open it up for comments or questions, because we have a few folks who have to potentially go. The whole transcript will be available, though, and all comments will be shared with all council members.
I apologize that I have to go back to an important meeting. I do want to just clarify one thing about my own, since my reputation has been besmirched here, is I think I do have a very long record of writing against the legalization of euthanasia. So the association of me and that seemed a little strange, given, I don't know, at least 30 years or 25 years of writing on the topic against the legalization. So just to clarify the record for everyone in the room. Thank you.
Can we?
No. That you're opposed to assisted suicide, but that you are in favor of the withdrawal of medical care, which accomplishes the same thing. So you had this article with Margaret Batten, who is an accomplished.
So, sir, it's not a. Your statement was read into the record. It's not the time for debate, but we appreciate your comments, and we apologize for the break in the panel. But we just wanted to have that break.
Now, despite his squirming, Ezekiel's health policy, and therefore the policy being presented by Obama as health reform, is clearly stated in the article I mentioned earlier, Principles for Allocation of Scarce Medical Interventions. It begins with Emmanuel and his Nazi doctor's Malthusian claim that healthcare resources are scarce, calling scarcity the mother of allocation. But they don't tell you that this is caused by the withholding of resources by the HMO system they themselves promote. The only sensible thing to do, they say, is to find out how best to allocate these scarce resources, but even the current proposed criteria for denying care, like quality-adjusted life years, QALYs, and disability-adjusted life years, aren't quite literally cutting it. They analyze the pros and cons of these kinds of models. The pros of all of these things deny care. But they're just not Nazi enough for these guys. What Ezekiel proposes is something called the complete life system. The basis of this system is the idea that care shouldn't be given out on the basis of stages of life, like infancy and the latter stages of one's life, but should be allocated on the basis of complete lives, that is, ages 10 to 50 years. The rationale is that death of adolescents is worse than the death of infants and those of the elderly. So we can save costs if we allocate our scarce resources not to the vulnerable infants and the used-up elderly, but to the healthy 10 to 50-year-olds. Here are some quotes from this article I referenced that get into the twisted logic that goes into the complete life system. Strict youngest first allocation directs scarce resources predominantly to infants. This approach seems incorrect. The death of a 20-year-old young woman is intuitively worse than that of a 2-month-old girl, even though the baby has had less life. The 20-year-old has a much more developed personality than the infant and has drawn upon the investment of others to begin as yet unfulfilled projects. Consideration of the importance of complete lives also supports modifying the youngest first principle by prioritizing adolescents and young adults over infants. Adolescents have received substantial education and parental care, investments that will be wasted without a complete life. Infants, by contrast, have not yet received these investments. Similarly, adolescence brings with it a developed personality capable of forming and valuing long-term plans whose fulfillment requires a complete life. As the legal philosopher Ronald Dworkin argues, it is terrible when an infant dies, but worse. Most people think when a 3-year-old dies, and worse still, when an adolescent dies. This argument is supported by empirical surveys. And the last quote, "The complete life system discriminates against older people. Age-based allocation is ageism. Unlike allocation by sex and race, allocation by age is not invidious discrimination. Every person lives through different life stages rather than being a single age. Even if 25-year-olds receive priority over 65-year-olds, everyone who is 65 now was previously 25 years. Treating 65-year-olds differently because of stereotypes and falsehood would be ageist. Treating them differently because they have already had more life years is not. Age, like income, is a non-medical criterion, inappropriate for allocation of medical resources." So what do you get if you make it past 10 years of age after you're born, or make it to the age of 50? Infanticide and euthanasia through denying care. Exactly what Emmanuel was caught lying about. So he not only wants to kill your grandmother, but also your firstborn. As the chart in the article displays, this reduces the average life expectancy to the equivalent of some of the life expectancies of the poorest third world countries, with the goal of reducing the world's population as a whole dramatically. This is exactly what Obama's team of experts will be implementing if his health reform is not stopped. We should probably refer to these team of experts as the T4 team, because the last time this was proposed and implemented was under Adolf Hitler in 1939. He used the excuse of economic crisis and war to launch a euthanasia program run by a team of experts who decided who was desirable and who was not, and killed the latter. Dr. Emanuel, don't you know that this is exactly the same policy as the Nazis? Don't you know that what you propose are crimes against humanity? Don't you know that for such crimes we persecuted and prosecuted Hitler's leading doctor, Karl Brandt, who was tried and hung at Nuremberg for following the exact same orders by Hitler? Are you being so stupid as to try the same thing here? With this policy being stated in the open and currently being pushed by President Obama, although being denied by Zeke Emanuel, the only question to be answered is what else is the Obama administration lying about? Or more importantly, how are we going to